What are we going to do today? What we are basically doing today is we are making a case. We are making a case for why evidence-based practice is actually very important in public health. Yesterday, our discussion rotated around um, evidence-based practice in the clinical area. The concepts are basically the same, largely, but there are slight variations on the approach. The approach um, is what slightly differs in comparison to what happens in the hospital setting and what happens when you are operating in a public health arena. So, in a public health arena, what are we interested in? We are interested in knowing why evidence-based practice is actually very, very, very relevant in the practice of public health. So let's basically start. One thing you need to know is that health problems are complex. We often use the word multifaceted, complex. They are not linear, that you have a cause and effect. No, you can have one health problem that is actually caused by multiple factors. Okay, so they are complex and they require interdisciplinary approaches, or what we can term as cross-disciplinary approaches. So you cannot have only one discipline addressing one particular problem. It's not possible because health problems are complex in nature and they don't occur evenly. The problems don't occur evenly. The meaning of that is that um, different people experience the same problem differently. The burden is not usually the same. So you have an even distribution of the health problem across populations, or what we are basically terming as the unequal occurrence of a problem across populations. So basically, to be able to tackle health problems using the public health lens, you need to work with different stakeholders through collaborations and partnerships, through interdisciplinary research or transdisciplinary research or cross-disciplinary approaches. So you see that you need different people to bring their expertise to the table in order to address problems. For example, addressing a simple problem in a layman's sense, a simple problem as such as stopping people from using tobacco. When you say this to a layman who is not a public health professional, they may think that is a very simple problem. It's not. Why? Because it requires collaboration amongst different people coming from different backgrounds. Public health professionals, medical doctors, business individuals, um, advertising specialists, behavioral scientists. So all these people will look at the problem of tobacco smoking using different perspectives. Okay, using different perspectives, and that therefore means that a simple problem such as a campaign to reduce the use of tobacco among a given population can be quite very complex. Similarly, a problem to do with obesity reduction. Again, different stakeholders, urban planners, production of food, that is agriculture, transportation, schools, the health sector, all these are actually needed. Okay, so you can see that you don't have a very simple public health problem. All problems are complex in nature. And as such, to tackle problems, you need evidence to be able to convince people such that they can buy into the intervention that you want to put across, or basically you want to implement. So, just like any other science discipline or scientific discipline, evidence will always have to come from research. Now, there is a problem here that in public health, you will not always conduct what we term as randomized control trials, because we say that randomized control trials actually give you the best level of evidence that you can ever have. The best quality of evidence can come from randomized control trials. And then you have the best of the best if you systematically review the randomized control trials, and you have the best of the best evidence that you can ever have. But in public health, you will have what we call quasi or community trials. Okay, so this will give you evidence, but this evidence will not be as equal to, in terms of quality, to the randomized control trials. So you have that problem. And of course, in public health, we carry out interventions. You can call them programs, you can call them projects, or we basically enact policies. And we need to see whether this what we are doing is actually effective or not. And therefore, instead of having the best kind of research that we can carry out in terms of, let us say, in terms of clinical trials, we can end up with what we term as evaluation research. So evaluation research, what kind of evidence can it produce? And will this evidence be, for example, one, transferable? The findings can the findings be transferable? Can we say they can be generalized? All these questions are very, they will always be in our minds as we design these public health interventions. And of course, we cannot forget the other sources of this evidence, apart from what I've just talked about. Some of this evidence can come from what we call community interventions practice. Okay. Yesterday we hinted on elements to do with the translation and knowledge translation, or what you can term as translation, basically, which is also very, very important in the context of evidence-based practice. What is it all about? Is that, you see, you can have the best evidence on table, but this evidence is not being utilized. So you'll have a problem that you have evidence, but application becomes a problem. So that is a translation problem. So how do you get evidence and also test it in the real world? So even, for example, even in the process of, let us say, development of vaccines or drugs, the processes can always be followed, even with these volunteers who will volunteer to you for the drug to be tested on them, and things like that. So the drug might actually work among these recruited research participants. But when it comes to using that drug or that vaccine in the real community, the findings can actually be different. Okay, so that is another problem that can actually happen, especially in the context of public health, that sometimes you have proven interventions, but when they are taken into the real world, where you don't have a lot of controls, that intervention may not actually work. Okay, and then the other issue that we always have to deal with is the dissemination of this evidence about what works, what we are terming as proven interventions. And this dissemination has to happen at all levels of public health, whether state, whether county, whether the local public health authorities. But also very important, among different stakeholders. Because it is not only public health professionals that use this evidence. You will have clinicians, you will have community members, people who are running, let us say, community-based organizations and things like that. They are all interested in understanding the evidence that we have about interventions. So therefore, collaborations and the networking become very important across the different disciplines and sectors. So if I'm to recap, evidence-based public health is about the judicious use of evidence for populations and populations or communities. Now, the word judicious is what is very important here, that not all evidence can actually be applied. You can have the best evidence in a particular area, but that evidence may not be applied in another area. Okay, so the meaning of that is that be very careful when you're applying this evidence. So the word judicious means be careful with how you use evidence because it may not apply. And then the other word, which basically gives public health the face that it has, is that everything that we do is either on particular populations or basically communities. So how do you use evidence to improve the health of particular populations? What we are emphasizing is that this evidence has to be judiciously used, okay? Such that at the end of the day, we don't waste resources and we only invest resources on what works, because there are interventions that do not necessarily work. But also, when you have evidence, the decision on how you can use that evidence rotates on other factors. So evidence can never be a direct antidote. Okay? Evidence can never be a direct antidote. The meaning of that statement it is that sometimes you need to synthesize, evaluate this evidence and see whether you actually have the resources to implement what is said to be working, or you don't. What are your values? What are the cultural factors associated with a particular proven intervention? Because an intervention will always, it will not work in vacuum. There will always be context to that proven intervention. What works in one community may not work in another community. So what are the community's preferences, cultural norms, values, and needs? Because that is also very important. So you have the best evidence, but does this evidence fit into a particular group of people, a particular community? Do you have the resources and the expertise to do that? What are the environmental and organizational contexts related to what you have? Okay, so we